This is Talk with Audrey. Welcome back. Fitness, nutrition, and mindfulness are common ways that people maintain healthy lifestyles as they get older. But one thing often left off that to-do list is adult vaccinations. My guest today is Dr. Len Friedland, the Vice President and Director of Scientific Affairs and Public Vaccines at North America GSK, and he joins me now with some important information about a vaccine available to help prevent shingles. Welcome, Dr. Friedland.
Thank you, Audrey.
Thanks so much for joining me. So I hear a lot about shingles. What is it?
Yeah, so shingles is a very common disease that can be debilitating and devastating for older adults. The disease shingles is also called herpes zoster, and it's caused by a reactivation of the varicella zoster virus inside our body, that same virus that causes chickenpox. Now, 99% of adults over the age of 50 have evidence of having had chickenpox when they were children. Even if they don't think they had a case, more than 99% of people over age 50 have evidence. And when we get a case of chickenpox, well, the disease symptoms go away. The virus doesn't leave our body. The virus essentially goes to sleep. It goes dormant inside our nerves, and it just stays there. But it can reactivate, it can come out of the nerves and cause shingles. And the major risk factor for that is advancing age. As we age, our immune systems decline, and this virus can wake up, travel down our nerves, and cause this very painful, debilitating condition called shingles. 1 million new cases every year in the United States of shingles. For people over the age of 50, the lifetime risk is 1 in 3. So 1 in 3 people over age 50 will develop a case of shingles. It's very common. And in people who are lucky enough to live to 85, the risk goes up to 1 in 2 will develop a case of shingles. So very common illness, and it's caused by a reactivation of the chickenpox virus, which is in more than 99% of our bodies in people over the age of 50 here in the US.
Well, what triggers the reactivation of the virus?
Great question. The major trigger, the major risk factor is advancing age. Our immune systems decline as we age. It's something we can't control. It happens to all of us. We all get older, and our immune systems get older as well. And when that happens, both in the quantity, the number of our immune cells, and the quality, how they work, it essentially can decline. And when that happens, the virus can wake up, reactivate, travel down our nerves, and cause this condition called shingles, which is a painful, itchy rash that typically occurs on one side of the body. The painful rash can last 2 to 4 weeks, but even when the rash goes away, the pain can persist. And if it persists for more than 3 months, it becomes a chronic painful condition, and that chronic painful condition we call post-herpetic neuralgia. And post-herpetic neuralgia can last from months to years. And imagine having chronic, debilitating pain every day of your life for months, if not for years. And up to 18% of people who have a case of shingles will go on to develop this chronic, painful condition that can completely change people's lives, their ability to work, their ability to sleep, their ability to do their activities of daily living. It can completely change people's lives, and it can be very devastating. And there are other complications as well, including some very serious eye complications that can occur. And so the best thing to do for shingles is to prevent it from happening. We can't prevent ourselves from aging, but we can prevent the disease itself through vaccination.
Whoa. Actually, in the occasions that I've heard about someone having shingles, it seemed that they had a stressful event or something traumatic. Could stress be a contributing factor?
Yeah, that's spoken about, but I think in general we all have stressful events. We can't avoid that as we age. But as we age, we need to do things to keep ourselves healthy, mindful, living well, as you talked about in your introduction. So of course, good exercise, nutrition, trying to decrease stressful situations, but life goes on. And we know that shingles is going to happen. 1 million new cases every year in the United States. 1 in 3 people over age 50 will develop this disease. as they get older. So the major risk factor here is advancing age. There are others as well, people who are immunocompromised, they're at increased risk for shingles, but the major driver here is advancing age. And so as we age, we need to think about what can we do to prevent diseases, right? We want to keep our blood pressure well, we want to make sure we're getting our eye exams, we want to make sure we're getting, our checkups, and we also want to speak to our doctor and pharmacist about what are the vaccine preventable diseases that we can prevent through vaccination as we get older. And there are a number of these in older adults. And today we're talking about shingles because not only is it very common, it's because there's a vaccine available today that is preferred by the Centers for Disease Control to prevent shingles. And that vaccine is called Shingrix, which is the shingles vaccine that was discovered and developed by our team at GSK Vaccines. And this vaccine, Shingrix, is recommended by the CDC for all people over age 50, and it's the preferred vaccine for all people over age 50. Shingrix is a 2-dose vaccine, where the second dose is given 2 to 6 months after the first dose. So it's really important to speak to your doctor and pharmacist about vaccination and get the 2 doses of the Shingrix vaccine, which is the vaccine that's recommended for all people over the age of 50. But you can recognize that with all people over age 50 in the United States being recommended to receive the Shingrix vaccine, there's been unprecedented demand for the vaccine. And so when you go speak to your doctor and speak to your pharmacist if you're over the age of 50, it's possible the vaccine may not be available right then and there at the pharmacy or at the doctor's office. But be patient, be persistent, because we're shipping more and more vaccine on a very regular basis. Get on a waiting list. Ask the pharmacist and the doctor to call you when the vaccine becomes available. And when you get that first dose, schedule the second dose 2 to 6 months later, right then and there. There's also a vaccine locator at the website shingrix.com, SHINGRIX.com, where you can put in your zip code and you can see which doctors and pharmacies in your area have had vaccine available in the last few months. And one last thing I'd like to add is that Shingrix is covered by insurance. So for people over the age of 65, in Medicare, it's covered under the Medicare Part D plans. And for people under the age of 65, Shingrix is covered by the private insurance plans. But speak to your doctor, speak to your pharmacist about vaccination.
All right, good words of advice. I've been speaking with Dr. Len Friedland, the Vice President and Director of Scientific Affairs and Public Health Vaccines, North America GSK. And we've been talking about a vaccine to help prevent shingles. So check out that website. And if you'd give it to us one more time, Dr. Friedland.
Sure. So the first thing, of course, is to speak to your doctor and your pharmacist. They're your best resources for medical advice and health advice and vaccinations. CDC has great advice for vaccinations. And then at the website shingrix.com, SHINGRIX.com, there's information about the disease shingles, the vaccination to prevent it with Shingrix, the CDC recommendations, and this vaccine locator to see which doctors and pharmacies have had the vaccine available in your community in recent months. Shingrix.com.
And as always, a reminder, be sure to speak with your doctor or healthcare provider. Thanks so much, Dr. Friedland, for joining me.
Thank you.
You're very welcome. And I'll be right back after this.